Hi, my name is Dr. Huang. I'm an infectious diseases physician working at the Burnet Institute on one of the biggest infectious disease threats globally, tuberculosis, or TB. When I tell people in Australia that I work on TB, I'm mostly met with a surprised look and a response along the lines of, "Oh, I didn't realise that was still a health issue." But in fact, despite being preventable and treatable, TB is the leading infectious disease cause of death globally. To give you an idea, in 2020, the COVID-19 pandemic claimed 1.8 million lives globally, a devastating toll. By comparison, an average of 1.5 million people have died from TB, not just in 1 year, but every year for the past few decades, despite being declared a global health emergency by the World Health Organization back in 1993. While we don't see a large number of TB cases in places like Australia, the Asia-Pacific region suffers from a major burden of TB. TB disproportionately affects poor, marginalized, and vulnerable populations, and this may partly explain why it's been relatively neglected. Today is World TB Day, to raise public awareness about the devastating health, social, and economic consequences of TB. This year's theme is "The Clock is Ticking," to convey a sense of urgency on the need to act. The COVID-19 pandemic is having a tremendous impact on the global community, directly and indirectly, through disruptions to essential health services such as TB programs. But it has also demonstrated what's possible with political will and global commitment to a cause, with the rapid development of diagnostics, therapeutics, and now vaccines, all tools also desperately needed in TB. There are many parallels in the public health response, including the importance of active case finding, contact tracing, infection control, and the need to engage and consult with local communities. The global TB pandemic has been with us long before COVID and will be with us well after. But what we have seen with the global response to COVID has given us hope that through strong political commitment, investment in research and innovation, and taking a patient and community-centered approach, we can make an impact and work towards the elimination of tuberculosis globally.